Good evening. I'm Dr. Nishant Kumar, Professor of Anesthesiology and Critical Care at Lady Hardinge Medical College, New Delhi. Now, I am here to tell you about anesthesiologists. Now, many people don't know what anesthesia is or what do anesthesiologists do. Anesthesia is a specialized science of branch of medicine which deals with letting you have a painless and a memoryless surgery. So the basic job of an anesthesiologist is to make you go through painless and an amnestic surgery. That means that while you're having your surgery done, you're completely pain-free, you are unaware, and the surgeon can proceed safely for your surgery, and the anesthesiologist takes care of you right from the start of the operation, rather before the operation, during the operation, and even after the operation. An anesthesiologist is not only involved during surgery, but it's also involved for pain services. And if things go awry in the ICU, that is also managed by anesthesiologists. Now, what is anesthesia? Broadly speaking, anesthesia uh, consists of three main things. That is amnesia, analgesia, and areflexia. Now, what do these mean? Amnesia means that once you get the drugs, you won't be aware of what is going on. You won't remember what has happened to you during the period of the surgery. That is analgesia. That means that you won't feel any pain, and areflexia means that you won't move during surgery, so that the surgeon can perform his surgery carefully and precisely. Now, there are many ways that anesthesia is administered. Usually, before the patient is posted for surgery, there's an anesthesia consultant who looks after you, who asks you questions. And it is always better that you inform about your health conditions, about the medications that you're taking, about any allergies, about any other events, any family history in detail to the anesthesiologist, because the job of the anesthesiologist is to maintain your normal body physiology, your normal body functioning during and after the surgery. Now, there's a myth that if you hide, you'll get an early day. Now, that can be really be harmful. Hiding information or giving false information can really risk your life. Now, anesthesia surgery is a stressful procedure, right? So if you have some conditions, underlying conditions like diabetes, blood pressure, chest condition, asthma, COPD, now these have to be optimized before you can be taken up for an elective surgery. That means a surgery which can actually wait, and your other conditions can be optimized. It's simply like that you're making a part which is not uh, which is a faulty, go under stress, and ultimately what will happen is a breakdown of the machine. So that is what the anesthesiologists don't want to happen. So if any of the parameters is not in order, it is always better to optimize that part. Like if your BP is very high, it is better that you control the BP. If sugars are high, it is better that the sugars are controlled. If you are an asthmatic, you have a chest condition, you have a wheeze or sound, and you cannot hold your breath for at least 20 seconds, that means that you require medications before the surgery can proceed. Now, this is all which is done during the pre-anesthetic checkup. Otherwise, all the other blood investigations are also done, and X-ray is taken. In certain instances, an ECG can be done, and other specialized investigations can be advised by an anesthesiologist. Now, this is basically to optimize you for the surgery so that minimum harm happens, or if anything is wrong, that can be taken care of during the surgery, right? Now, as I said, anesthesia can be of different types. Broadly, anesthesia can be divided into three types. That is local anesthesia, regional anesthesia, and general anesthesia. Local anesthesia is where you numb a small part of the body. You are fully awake. You give a small injection in the area where the surgery is to be performed. It is usually done for minor procedures in the minor OT, and the presence of anesthesiologist is usually not required, like getting your teeth extracted. Regional anesthesia can have different connotations. Now, we have something called as a spinal anesthesia and epidural anesthesia, in which a needle is inserted under local anesthesia into your spine, a drug is given. Drug means the medicine is given into your spinal cord, and the area below the waist becomes numb and you can't move or feel anything below the waist. Now, this is usually temporary. This lasts around 2 to 4 hours, and after that, you'll be normal as before. So, nothing to worry about. You might be given sleeping medication so that you are not aware of what is going on. But yes, you can hear, you can see, and you can even feel in the upper part of the body. Now, these procedures are usually, this anesthesia is usually given for the legs, surgery on the legs or the lower abdomen, or in gynecological procedures. Now, this is completely safe. Some have a misconception that putting the needle in the back will cause chronic backache, but that is not true. Okay. Now, this anesthesia is most commonly used for pregnant women undergoing cesarean section because this is considered safe and has been time tested. Same anesthesia is given for fractures of the leg and surgeries on the leg and lower limb, and surgery like hernia, etc. Now, the other part of regional anesthesia is giving nerve blocks. Now, we have nerves which supply different parts of the body. Now, we have the ability to block only a part of the body. Like if the surgery is to be performed on the left arm, left shoulder, or left arm, or left forearm, or left wrist, I can simply give a small injection here, or here, or here, and block only the left arm, and rest of the body will not be affected. And you'll be aware. However, if you're anxious, sleeping medications can be given so that you can sleep peacefully throughout the surgery. That's called a peripheral nerve block. Almost any part of the body can be blocked using this particular technique. Now, general anesthesia is a bit more complex. In this, what happens is that medication is given through a small needle which is placed in your hand, which is called an IV cannula, and you lose consciousness, and at times you lose breathing also. A small tube is put into your windpipe, and breaths are delivered by the anesthesiologist. In this case, there are certain drugs which are administered, and rather a lot of drugs which are administered to attain the three components of anesthesia, as I had said before: the amnesia, analgesia, and areflexia. Now, there's a very common misconception that the anesthesiologist is not present. The anesthesiologist just gives the drugs and goes away, and when the surgery is over, he comes in and wakes the patient up miraculously. No, the anesthesiologist is present throughout the surgery. Each part of your body is monitored. That is your heart rate, your oxygenation, the carbon dioxide that comes out, even at times the depth of anesthesia. That means how deep is your anesthesia. If blood pressure, everything, urine output, everything is measured by the anesthesiologist. It is the anesthesiologist who decides when blood has to be given, whether the blood loss is sufficient enough to warrant blood transfusion or not. It is the anesthesiologist who maintains the normal body functions during the surgery. The surgeon is busy doing the surgery. Rest of the things are handled by the anesthesiologist. Any drug reaction, any complication, that is handled by the anesthesiologist. So the role of the anesthesiologist is very important. And many patients ask, okay, once the surgery is over, how soon can I get up, or how long will it take to come out of anesthesia? Now, that depends. If the surgery is uneventful, if the surgery is not prolonged, there have not been many fluid shifts or blood loss during surgery, it usually takes around 5 to 10 minutes, depending on the last dose of the anesthetic administered. So the patient wakes up almost immediately after surgery, that is within 5 to 10 minutes. But if there have been problems, if there have been complications, at times we do not take the patients out of anesthesia and shift them to ICU for further management. Also, general anesthesia can be divided again into two types. That is, one is inhalational anesthesia and total intravenous anesthesia. They have all their own drawbacks and pros and cons. So the thing is that inhalational anesthesia, basically a gas is given and you inhale it and you become unconscious. Whereas in intravenous anesthesia, medications are administered through the IV cannula in your hand, and the consciousness is controlled through that. So that is the main role of the anesthesiologist. And once the patient comes out of anesthesia, he's again monitored in the post-anesthesia care unit. And if the patient is feeling pain, analgesics are administered. Again, vitals and bodily functions are monitored. And only once the anesthesiologist is convinced that everything is fine, the body is working fine, and the patient is out of the effects of completely out of the effects of anesthesia, only then he is shifted to the ward. And also the anesthesiologists take care of chronic pain. They are pain specialists who are basically anesthesiologists. They are specialized in pain. They take care of pain. And it is the anesthesiologists who manage the patients, the complicated patients in the ICU using various drugs, ventilators, and other procedures. So this is in short about anesthesia. Don't be afraid of anesthesia test. Please share all the details with the anesthesiologist. If you have any doubts, all anesthesiologists would be glad to clear your doubts. And the choice of anesthesia solely rests with the patient. However, there are certain surgeries. You can always opt for general anesthesia. You can refuse for regional or local anesthesia. But at times, there are conditions where regional or topical anesthesia is safer than general anesthesia. Modern anesthesia is very safe. The chances of error are definitely there. The risk is definitely there. I mean, I'm sitting here. There's a risk that the roof might fall off. There might be an earthquake. So the risks are always there. But if you're fit, the risks are very minimal. And as the nature of the diseases, the number of diseases, and the severity of other diseases increases, the risk of anesthesia will definitely increase. Now, there are certain medications in heart patients and in blood pressure patients and diabetics, which may ask you to avoid. So that is solely on the basis of the anesthesiologist. Please don't think that the anesthesiologist is trying to dissuade you from surgery or postponing your surgery. It is all for your own benefit. So that is all about anesthesia. Thank you.